Welcome back to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today we have a 10-year-old male neutered lab. This dog has intermittent gagging and it's substantially worse after drinking water. Last week we learned about esophagrams, that we watch for pharyngeal contraction, bolus delivery to the esophagus, and then transit within the esophagus to the stomach. So here we have a dog today. This is the cervical vertebral column. Below that, in the soft tissues of the neck, we have the esophagus. And you guessed it, there's a bolus of barium-soaked kibble in this dog's esophagus because today we're going to look at an esophagram. We're going to focus today on the esophageal findings in this case. Here, let's watch him swallow his barium-soaked kibble. And a second swallow followed quickly after. As we go into the thorax, back to the neck, another swallow. You can see as we go into the thorax, crosses the diaphragm, and one more time through. So many of you will recall from last week that we like to see the bolus have this teardrop shape with a nice round leading edge, a little bit tapered on the caudal end, or on the cranial end. We like to see it going briskly through the esophagus, riding that primary peristaltic wave all the way to the stomach. So far, what I'm seeing in this case looks pretty normal. But we're not done our esophagram. It's important to assess the handling of both liquids and solids in these cases, especially for this 10-year-old lab because the history indicates that it might be liquids that are not adequately handled. So let's look what happens when we give just plain liquid barium without the kibble. Just to orient you, we again have the cervical vertebral column. Here we have the first rib at the thoracic inlet. And this time you can see the bolus looks a little different. This is in part because it doesn't have kibble, giving it that round kind of glob appearance. But I want you to watch, does this bolus move? It's kind of staying relatively stable. You can see there's a lot of motion of the adjacent soft tissues. This is actually the motion of the dog chewing and panting. And the actual bolus, you can see it's relatively retained. There you can see when it first arrived in the esophagus, and it's just not initiating that primary peristaltic wave, and that barium is not being propelled through the esophagus and zipping down towards the diaphragm like that first bolus. Let's look at one more. Here we can see a different swallowing event, but a similar observation. So I would say we have bolus elongation. We have lack of primary peristaltic wave. You can see that I don't have that bolus shape that I like. If anything, in this case, it's almost where the leading edge of the bolus is pointed. That's often a sign of dysphagia, especially with liquids. No matter how many times we watch, we have the same thing on all the images, that liquid boluses are in fact retained in the esophagus. A primary peristaltic wave is not initiated, and there's bolus elongation, bolus splitting. So the diagnosis in this case would be esophageal dysphagia. We can see that it's mainly affecting the handling of liquids. It's not usually possible to define the underlying cause of a functional dysphagia with fluoroscopy, but weakness or dysmotility, as with neuromuscular conditions or systemic conditions, would be the main considerations here. We do not see any structural changes in the esophagus in this case. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.